want to thank the people of Worcestershire for their support and certainly their charitable support early in the year. I'd like to thank Sir David as chair and the rest of the board members for your support and challenge and relentless drive for improvement. The catchphrase "better never stops" is becoming a well-used framework for how we want to continue to improve the services for our patients. I'd like to echo Sir David's thanks to our partners and our regulators, and also our stakeholders, particularly our local MPs and our councillors, who have supported us in so many ways over the course of the last year, and also have helped with some of the wicked issues in relation to, for example, the space constraints in the emergency departments and lobbying for extra capital funds, which have been welcomed by our staff, and we're in the process of using those in order to improve the experience and outcomes for patients. And then finally, I'd like to thank my executive team, who have been absolutely brilliant over the course of the last year, without whom I think very little progress that we are going to cover here in a short set of slides would have been achieved. And I think, as Gareth Southgate, I'm sure at some point yesterday on his interviews on TV and radio would have referenced that actually it's your team that make the difference, and I want to pay tribute to them this afternoon as key members of the staff of the organisation. So, getting into the review of the year, as Sir David said, a year like no other, and I think it's also worth noting that we were continuing to run as many services as we could over the course of the year, whilst needing to understandably prioritise the care of sick patients and make sure that our staff and patients were as safe as possible. You can see there's some numbers in the infographic, but over 2,000 of our COVID patients that were sick enough to require inpatient care were discharged safely home, which I think is a phenomenal success for our staff. We delivered care out of 6 intensive care units. Worth noting, we usually only have 1 on the Worcester site and 1 on the Alex site, and paying tribute again to all of our clinical teams that stepped in, helped our intensive care teams with staffing, to particularly the nursing staff who were having to step in and support patients where perhaps relatives ordinarily would have been, and recognising that it's been a very difficult time for everybody. We've also seen quite a lot of innovation over the course of the last year. We've moved to things that perhaps the NHS has wanted to do for a long time but struggled to. So we've changed the culture around remote working. It's become much more of a normal thing to do now, to do something for those that can, to work from offices or home kitchen tables, and being able to be very efficient and productive in the meantime. And clearly that's something I think we will want to continue to adopt, but also for many of our patients, having virtual telephone calls rather than travelling up to the hospitals, where that has been safe to do, as I think has been a real step improvement in terms of patient experience. That's not worked for everybody, so we need to be conscious that we need to continue to meet the needs of different patient groups, and making sure that people feel that they are getting the care, the compassion, the support that is possible. We've also seen many clinically led innovations. We're now remote monitoring a cohort of our respiratory patients who have had a long-term condition that has perhaps required hospitalisation. We're now able to preempt when those patients are starting to get into difficulty, to avoid a hospital attendance or a hospital admission. Those are the kind of clinically led things that we've seen over the course of the last year, which have started to revolutionise the way in which we deliver care. And what we're trying to do is make sure that we hold on and enhance those in our care delivery as we go forward into this year and future years. But it has been really quite a unique year. And I should at this moment pause and just recognise that we have lost some of our staff during the pandemic, and we've also seen many of our staff struggling to cope with the demands of, as I said, 12-hour shifts in full PPE, or indeed just the pressure of the workload. And we're very conscious as a board and as an organisation that our staff are our greatest asset, and therefore we need to make sure that we're supporting our staff as well as putting our patients first. Next slide, please. And as I said, there's been a lot of development and a lot of achievements. And the picture there is one of our consultants who is the first member of our staff to receive the Pfizer vaccine, and again paying tribute to the NHS and the scientists that have developed the vaccination program, which has been a phenomenal success, particularly in Hereford and Worcestershire, where the organisation led by our primary care networks and by the CCG has really made sure that the people of the county have been able to be vaccinated in high numbers. And of course that all started in the county from the Alex Hospital vaccination hub that was put in place and ran from December through into February. So again, phenomenal initiative and hard work by our teams. So David mentioned the exit from quality special measures, and whilst I think it's right and proper to recognise the hard work of everybody, it is worth noting that as far as the Care Quality Commission were concerned, they were satisfied that we could have exited quality special measures earlier than we did. They were looking for the wider health and care system to wrap their arms around the services provided within the acute trust to make sure that patients were getting the right services throughout the system rather than just in focusing in the hospital. And of course, I would say that better never stops. There's more that we can do as a health and care system to make sure that the organisations in the patch continue to improve the services and the efficiency and the use of resources, and not just in isolation. In terms of staff and wellbeing, I've talked a little bit about that already. We've done a lot. There's always more that we can do, and I think as an organisation, we are now listening to our staff better. I think there's always more that we can do, but I get the sense that there's a freeing up within the cultural development in the organisation where people feel able to raise their concerns. Not everywhere, and we've seen, particularly maternity, where some staff have felt not able to speak up, and clearly that's an area that we continue to focus on. Part of the conversation with the ITU staff on Monday was very much about clinical trial participation, and I think it's worth noting that as an organisation we contributed to the clinical trials that have led to better treatments for COVID positive patients, particularly the dexamethasone based trial, the recovery trial. We were the second highest recruiter in the region, so pretty much every patient that came in with COVID needed to opt out of a research study rather than the normal process of opting in, and that has helped to drive forward both national and international development of appropriate treatments for this nasty virus. In the meantime, we've continued to develop our response to urgent emergency care with again a refreshed approach to those patients that don't need to come in by an ambulance, but perhaps have been referred via the 111 service or via their GP, and making sure that we avoid those patients being admitted and they're well looked after and discharged home with the right level of support. And as Sir David mentioned earlier, we've seen a really positive increasing dialogue and visibility and awareness of some of the challenges faced by parts of our organisation and some of our staff, and making sure that we are able to respond to their needs and be an organisation that is inclusive and compassionate to all of our staff. Next slide, please. In terms of the operational performance, I think it's very much a mixed bag. and in many ways disappointing. But part of this has been as a consequence of the guidance nationally, particularly in the first wave, of stopping elective and planned services in order to focus our resources on the COVID patients. Clearly, during the summer of last year, we were restoring elective services for cancer patients, for patients on the referral to treatment pathways, for those waiting for a diagnostic test, and then wave 2 came along in December and put the mockers on our recovery of restoration and restoration of our services. So you can see there some improvements in stroke and emergency access compared to previous years, but a deterioration in waiting times for both cancer routine, elective and diagnostic services. And that's something that is an absolute priority for us this year and next year, and I suspect the year after, in order to recover the long waiters that I've referred to earlier. Next slide, please. This slide's got perhaps some more positive performance. We've seen the risk of blood clots and deep vein thrombosis through the venous thrombosis assessment improve over the year. Generally our hospital-acquired infections, Clostridium difficile, an improvement, but we're still not satisfied with where that is, and that needs further work, as I'm sure Paula will reference in the quality accounts section of today's meeting. And we've also, across this year, seen an improvement in our overall mortality rate. And this is important for our patients to know that when they come into our hospitals, they're going to be made better if they can be made better. And these two indicators, the average is 100. So our ambition is to get to below 100. And as you can see there, we finished the year certainly on the hospital standardised mortality ratio, the top one, with a significant improvement from where we were in the previous annual report. And also mixed sex breaches. This is where female patients are in the same clinical area as male patients and vice versa. That's a recognised national standard, and whilst we had a small number, that's still too many, a significantly smaller number than the previous year. So a good improvement, but more still to do. Next slide, please. And then in terms of the reference to the people and culture changes and focus within the organisation, I think as a consequence of COVID, we did see a tailing off of appraisals. That was an intentional direction to our staff to prioritise direct clinical care. We have seen a slight increase during this last year in our sickness absence, again partly driven by COVID infection or indeed isolation because of exposure to those patients or members of family that perhaps have been tested positive. And again, our ambition around our health and wellbeing for our staff is to support our staff in the right way. Mandatory training, we delivered against the target, and a significant improvement and reduction in our overall turnover rate, which we're hoping indicates that we're an organisation that people want to stay and continue their career in the NHS working with. Next slide. So before handing back to you, Chair, I just want to also just to recognise the work of Joanne Keeley, who some of you will know works in our abdominal aortic screening programme, and Joanne's sideline, if you like, is being a fantastic artist. And the pictures that you saw on Sir David's opening slide are all painted by Joanne. And having spoken to Joanne, we really impressed with her commitment, but also recognising that the staff that had their portraits done were telling stories of some of their concerns and worries, as well as some of the things that were going well. And I'd recommend to all of you the online exhibition that is now on the George Marshall Medical Museum website of all Joanne's pictures, because she's been if you like, a key component of the last year behind the scenes, supporting our staff and creating some fantastic pictures. Chair, I'll hand back to you, and again, we recognise the good work that everybody's done, but as ever, better never stops. There's more to do. And you're muted. Sorry, Dave.
Right. Okay. Well, thanks very much for that, Matthew, and thanks for everything that you've done over the last year or so in particular. We now want to move on to the quality accounting. Can I introduce Paula Gardner, who's our freshly appointed, young and dynamic Chief Nursing Officer, who's going to present the quality account to us. Paula.
Thank you, Chair. Thank you for that lovely introduction as well. Yes, I am new to the organisation, and I just wanted to thank the Trust for welcoming me so lovely into the fold of the Trust, which is just an amazing place to work, and I do not say that lightly. As you can imagine, as Chief Nurse, I would obviously thank the nurses, the midwives and our allied health professional group, but I also want to pay tribute to our support services staff, for without them during the pandemic, we would not have had the cleaning done or the portering done or the transporting patients where they needed to be. So it is without a shadow of a doubt that I give my heartfelt thanks to our support staff that have enabled the clinical staff to do what they needed to do. So again, thank you. Just as a little quick background, the quality account is something that we have to produce every year. And it contains an awful lot of information about what we've done the previous year and then what our priorities are going forward. I would like to do a big thank you to my deputy, Jackie Edwards, who has led on this with the Quality Hub to enable us to get all the data and to produce the quality account in the standard that it has been produced, especially given the fact that most of my clinical staff in senior roles have been working clinically as well. So thanks to Jackie. Next slide, please. So, as Sir David mentioned, we do start our boards with a patient story, and this particular patient story is quite heartfelt. This gentleman came to us in March and stayed with us for a month, and during that month of the start of the pandemic, obviously we had no visiting, but what he paid tribute to was how his care and treatment was of an excellent standard. He also understood, as Sir David laid out, that our staff, to enable them to come to work, would stay in hotels so that they could come and care for our patients. So again, you know, they have gone above and beyond. The patient had excellent treatment and was thankfully discharged. But during that time, obviously, we had no visiting, and we had to think of alternative ways to enable the patients to see their loved ones, and also for their carers and relatives to ensure that they got timely, accurate information, and that during the pandemic is quite difficult. So the Trust set up the Family Liaison Service that enabled that communication to occur between patients and relatives and vice versa. So that was his story to us as board, where it has worked, and it has enabled our patients to ensure they have that communication, which can only go some way to improving their health and well-being and to a timely and safely discharge. As Matthew has also stated, a year in numbers, and as you can see that we've still continued to have our ladies give birth, and we've still managed to treat patients as we've needed to, so I won't go through those numbers. If we go to the next slide then, please. So, as again, it's been mentioned about special measures, and that we came out of special measures. So CQC recommended that the Trust is removed from special measures. They requested that in September 2019. In December 2019, the ED, the emergency departments, were also inspected, and a Section 31 conditions were imposed upon us. And then in September 20, we were able to have NHS England and Improvement confirm that the Trust has been removed from quality special measures. And then in December 20, as Matthew has alluded to, we had a CQC inspection of maternity services, and their rating reduced from good to requires improvement, and we're working through an improvement plan on that. And then the good news story was that in May 2021, the CQC removed all of our Section 31 conditions for our emergency departments, and that in itself was an absolute boost to the staff coming through a year of the pandemic and having Section 31 imposed as well. So that was excellent. Next slide, please. So as we talked about on my first slide about the quality priorities, we want to ensure that our patients receive care that is safe, that is effective, and that it provides a positive experience for our patients and their carers. Care that is safe is obviously key for our patients and the population we serve, and we need to reduce that avoidable harm. And we looked at some 5 quality indicators that we wanted to ensure we worked on, which is, as you see, listed there. And I just wanted to pull a couple of them out. So Matthew alluded to the infection prevention and control. And whilst we've worked very hard around the COVID virus, what we want to do is make sure we focus on our other infections that are not COVID related. So our C. difficile and our MRSA and our MSSA. So again, it's making sure that we now target those, and from a C. difficile point of view, we want to make sure that we've got what we call an antimicrobial stewardship, so that we are monitoring our patients who are on antibiotics, that they're on the correct antibiotic, and that is reviewed frequently to ensure that we reduce them from using intravenous antibiotics to oral. So we're working on that, and that will be continuing through to 2022. Nutrition and hydration, we've still got some work to do, and we need to make sure that our patients are fed and hydrated in an appropriate manner and to their needs of the day. And we're still working on that, making sure that we ensure our patients are have fully nutrition and hydration needs met. We want to make sure, and as Matthew talked about the HSMR, that our care is clinically effective, and we want to make sure we further reduce our mortality rates. And we're also doing that through learning from deaths as well, so that any death that we do have, we review and make sure that if there's any learning, we would take that forward as a trust. The biggest thing for me is making sure that our patients have a positive experience. And whilst I'm not happy that we have complaints and that a patient has had to put pen to paper is really sad, but actually there is a lot of learning that can come out from complaints, and that we need to ensure we create that learning from themes in those complaints and take that forward in a timely manner and address those themes in areas, and then that is spread across the trust. We were pleased to say that our friends and family test recommended rates have increased and maintained, which is excellent news, because again, that's another marker for us to ensure that our patients are getting that positive care and treatment. And we would need to further embed the dementia bundle to all adult ward areas, and then consistently improve the outcomes of care for those patients with dementia, and especially their carers. And then following on from all of this, our next steps are our renewed and reviewed quality and safety improvement strategy, which will take us to 2025. And we're working on that right now. Next slide, please. And now I'll hand back to the chair.
Okay, thanks very much for that. That was some good progress, I think, across the year for the trust, but still inevitably a lot to do. But now I'll move on to the annual accounts, and can I introduce Rob Mackey, who our substantive CFO is currently undergoing surgery, and hopefully will be back soon. But Rob has stepped into the breach. He currently is the Chief Finance Officer of our partner organisation, Herefordshire and Worcestershire. So welcome, Rob, and thanks for taking the opportunity to talk to us about our accounts. Rob.
Thanks very much, Chairman. Thanks for the introduction. And I was just going to echo what Paula said actually previously. I've only been with the team for a week or so, but it's been a fantastic welcome actually, and I just wanted to thank everyone for that. So without any ado, let's turn to the accounts then, so if we could move on. Yeah. As with all finance directors, there's quite a few numbers and it's a bit busy, but I'll just try and summarise where we are. And I think the important thing to draw out here, as you probably expect, is that finance was a secondary importance last year, but as you'd probably expect, in the background, the Trust was working very hard to ensure it was maintaining sound financial controls to make sure that money was being used appropriately and as effectively as possible to support our staff and get patients treated. So what we've got here is just a kind of a summary, and what you'll see is there's clearly a very large change from the previous year. So we actually ended up the year with a surplus position, and that was largely due to the way the finances worked, and the activities of the hospital obviously changed quite considerably. But nonetheless, I think that there's a pointer to the future there, which was around stabilisation and sort of the path that we're looking to move forward with, as the chairman talked about earlier, in terms of that recovery. So just for the record then, I'm just looking at the kind of the central schematic. We did end up with a 6.7 million surplus, which was in line with what we were expected to do by the national team and within our system. We've got some quite big numbers on the top right hand. So that capital of 550 odd million is actually the closing balance sheet around our assets, and there was a very large technical adjustment whereby nationally they converted some previous loans and so forth for all NHS trusts actually into PDC, so public dividend capital on the balance sheet, and we saw a significant movement on that. The cash balance, 40 odd million, and again quite a change from where we've been before. I think it's beholden on me to point out the Trust played its part. It promptly was paying suppliers in the area, which is something that is really important, especially in times of constraint. So congratulations to all the team and staff for doing that. I talked about appropriate expenditure. We did get 18.2 million of COVID expenditure. There was quite a lot of scrutiny around that, and it was all appropriate, but it gives you a scale of the additional costs that were being driven. And alongside all of that, we still continue to deliver some ongoing waste reduction and efficiency. So whilst it maybe wasn't as much as we'd have liked or planned for, clearly it was still a significant effort and should give assurance around the work that's going on to make sure taxpayers' money is going as far as possible. Could we move on, please? Yeah, very busy slide, which just draws out in a little bit more detail the specifics of the income and expenditure. I won't dwell on it, but for those of you that are interested, clearly there's the comparative from between the previous year and the year that was in question, 2021, and that shows that very large move from an underlying deficit to an in-year break even. I think probably the main things I would normally draw out are we had quite a strange year for income, and as you can see, it was significantly higher than previously, and that just reflected the national arrangements. And probably on the expenditure part, around about 60% of the expenditure is in pay, which just hopefully reinforces the the human nature of the services we deliver here, which is all about our people, and both Matthew and Paul have talked to that in quite some detail before. Could we move on to the next slide, please? Thanks. So this is what our auditors had to say about us, which I'm clearly as a system partner really pleased to see, but the accounts were a true and fair view. They've been properly prepared, so all of the usual stuff you'd expect to see. There was a limitation of scope, which was a national issue, which was to do with the way the procedures were set up for distribution of PPE, so protective equipment for the COVID response, and there was a national response around that, and just limitations around what auditors could do. There's a note at the bottom. The annual report hasn't actually been able to be published as yet because there's one element which the auditors have had extra time nationally to complete, which is around the value for money, and actually there was a new regime put in place for this year, so it's a system assessment. We're expecting a good outcome from the auditors around that, but that's not due until later in August, with a national deadline actually of September. So at that point we'll be able to receive the certificate and publish. I've got one final slide just to pick up, if we can move on, which is just around the forward look. And again, it's just to say, actually, 2021 does see a continuation of the same sort of funding regime. So we're in a very different place to where we've been a couple of years ago. We've got these block contracts, which means that we are very much managing the COVID response, the recovery response, and working the finances to support that. There's a lot of work going on across the system. Probably me being here is a good reinforcement of that. And we've made some great strides around capital planning across the system, which is drawn out there, and significant work towards collective best use of resources programs across the system. That's all I wanted to pick up. So if I can hand back to you, Chairman.
Thanks, Rob. A very different year in terms of finance for the NHS, actually, not just this organisation. To reinforce the point that Rob made, although we were absolutely focusing our attention on delivering care for patients, particularly those with COVID, but others as well, as Matthew's identified, we still kept a control on the expenditure to ensure that taxpayers were getting reasonable value for money. So thanks for that, Rob. That's predominantly about the past. Now let's think about the future. Let's hand you over to Matthew to talk about that. Matthew.
Thank you, Chair. And just to reinforce the point that Robert and Sir David made, part of the journey for us within the context of the Worcestershire integrated care system, but also in the context of this year's financial regime, is to work with our staff to reduce waste and to improve the efficiency in which we use the Worcestershire pound. And as you can see from our strategic plan on a page, our third strategic objective around best use of resources is one of those that absolutely is the cornerstone of the focus for the next year or two, in order to drive down that underlying financial deficit that you would have spotted in Robert's slides, which to some extent are artificially clouded over in the last year because of the way in which the national finances were handled. But it hasn't gone away, and we need to continue this focus. So that is if you like, the foundation of some of what we need to focus on over the course of this year and future years. So next slide, please, just to summarise where our areas of priority will be. So this reset and recovery phase is very much around how we recover from the pandemic, whilst recognising that we are now very much in the beginnings of wave 3, and are planning for how we now start to reduce our waiting list, which grew by a third during the main waves 1 and 2 of COVID. It has got to be, if you like, insulated from wave 3 impact in order for us to reduce the waiting list. So there's quite a lot of improvement work already underway with our surgeons, our surgical nurses, and our theatre staff in the way in which we organise ourselves to reduce the waiting list for operations, which obviously are important, but also working with our physicians, surgeons, and outpatient staff in reducing waiting times for first outpatient appointments, particularly. And one of the areas that we've made positive strides in the course of the year, and we wish to continue that, is the way in which our GPs can access advice and guidance from our hospital staff for better referrals, if you like, more appropriate referrals coming into the hospitals. We have seen, as I'm sure everybody can imagine, quite an unmet patient need. We're now seeing high numbers of referrals with suspected cancer, and given that our hospitals are a major player in the treatment of cancer across the Midlands, we're keen to organise ourselves in the right way in order to treat people as quickly as we can with suspected cancer. And obviously, once diagnosed, having chemotherapy in our COVID-free hospital at Kidderminster, or indeed having surgery either on the Kidderminster site or the ALEC site, as we organise ourselves in line with our clinical services strategy, which we published at the end of 2019, and in many ways has stood the test of time through COVID, in the way in which we're keen to separate emergency surgery from planned surgery in order to make sure outcomes for both are in line with the best in the country. So the recovery of elective care is going to be a key factor, and at the moment our planning for that is within the budget that we've set ourselves. We're not planning to need to overspend in order to meet that recovery, but clearly that's being reviewed on a weekly basis as we go forward through the year. The other key factor for us, and I'm sure many people have seen coverage in the news over the last week or so, of the really significant increase in demand for urgent and emergency care across the country, and that's certainly being experienced in the county. We're breaking records almost on a weekly basis now for the highest numbers of tenders coming into the emergency departments on the Worcester and the Redditch side. Less footfall through the minor injuries unit, which is something we're working with our partners to ensure that the people of the county are helped to know where best to go for the issue that they feel they need to be treated for, and making sure that GP access and 111 service is meeting people's needs as well. So there's very much a partnership approach to meeting the needs of those with much higher perhaps unmet need as a consequence of COVID, both physical and mental health impacts. So that's very much two elements of absolutely crucial components of our priorities for this year, whilst working to reduce our deficit. Now, there's some really exciting things going on as well. We've been fortunate to secure quite significant amounts of capital money, the money that you would use for buildings, refurbishment, new intensive care facilities, where we've created specific infection control pods to make sure that those patients with infectious diseases are well looked after. We have the rebuild of the Worcester site AME department in the Aikenbury building, which is already underway, and we're well advanced now with planning for the expansion of breast services, breast screening, and we're considering how best to refurbish the operating theatres on the ALEC site and develop a surgical robot capability on that site as part of that theatre redevelopment. So some really important and exciting building projects. Of course, there will be disruption, which is inevitable, but I think for the greater good of the modern care of patients and for our staff, having the space in order to deliver the best possible care in more modern facilities. A key component of the way we're working, which I think Sir David touched on, and also Robert, is this national drive to develop integrated care systems. And I always think of this as Mrs. Jones, who lives in Castle Street in Worcester, that's got diabetes and congestive cardiac disease, doesn't get out of her home very often, has family living quite remotely, and relies on neighbours and perhaps a bit of social care support. Mrs. Jones expects that the GP that looks after her, that the carer that comes in, that the hospital consultant that's monitoring her diabetes, that they all talk to each other, work together to keep her well and at home for as long as possible. And that's in some ways, a failure of our system would be if Mrs. Jones ends up being blue lighted in, having had a deterioration in her care that was picked up by the carer, couldn't access immediate support from GP or community services, and the ambulance service bring her into an A&E department when frankly she's not that much worse than she would normally be. Now that's a failure of our system. What we're aiming to is to keep Mrs. Jones at home in Castle Street, in her own chair, sleeping in her own bed, making tea in her own kitchen for as long as possible, keeping her functional capability as good as possible. That's what integrated care means to me. Now, wrapped around that is a whole lot of perhaps bureaucracy and governance and ways in which we organise our services, but fundamentally this is about how we as a hospital work with our GPs, with our community nurses, with our social care staff, with our mental health care staff, to keep the people of the county well and at home for as long as possible, and not needing to come into expensive care settings until or unless they absolutely have to. It also means that the lady that was brought in last night by the ambulance service, who had signed and had her family agree to what we call an advanced care plan, we call it a respect form, where she did not want to be brought into hospital, but somehow managed to be brought in by the ambulance service to an A&E department that was busy. That's a failure of integrated care. That sort of thing is where we need to work with our colleagues to stop happening, because it happens all too often. So I'm looking for our staff and our colleagues to really step up and focus on Mrs. Jones, the lady that came in last night, and stop those things happening, because they're not good. They're not good for patients, they're not good for staff, and they're frankly not good for the taxpayer. Now, in terms of developing our focus on our staff and well-being, colleagues will be, and people on the call may well be aware that we, over the last 2 or 3 years, have developed a culture change program, which is very much behaviour-based, called Forward. It's the foundation of a lot of our focus on health and well-being with our staff, and we're in the process now of starting to consult on the second phase of that, how we really move towards systematising the approach to an inclusive organisation that's compassionate and caring to its staff and its patients. And only this morning we had a session with the board rehearsing some of the key components of phase 2. That's going to be fundamental to us in our drive towards being an employer of choice in Worcester, part of the Worcestershire employer of choice network within the integrated care system. And part of that is how we do improvement. How do we shift the culture from people coming into work, doing their work, and creating workarounds, and perhaps getting frustrated with the waste and the inefficiency, but not feeling able to do anything about it, to a place where our 6,500 staff come into work with the tools to not only do their work effectively, but also to know how to improve the work, to drive out waste, to improve efficiency, to improve quality and the outcomes, whether it's delivering, taking blood within the phlebotomy team, processing invoices within finance, recruitment processes. We want all of our staff to feel able and equipped and empowered to improve the way in which we do the work that we do. And we'll be launching later this year our single improvement methodology with a partner organisation to help us drive out waste, improve our finances, improve our quality. And we'll be looking for an appropriately inspiring name for that, because single improvement methodology certainly is not an inspiring name. So this next year is going to be very much about building on the successes of the last year, recognising the impact of the last year, recognising some of the super innovations and achievements. You'll see there Chief Inspector Phil Dolby on his way out of the hospital. I think we've referenced already that Phil's ideas we took on board and led to improvement. We want more patients, more people of the county to be involved in helping to shape the services that we provide for our patients, because in the end the people that experience care are the ones that we really need to listen to, as well as the staff that deliver it. So this next year I'm hoping we'll see a further step change in the way in which we organise our services, the way in which we manage our finances, the way in which we can develop our buildings to meet the needs of our services, the way in which we work with partners to help Mrs. Jones, and the way in which we support and empower our staff to continue the journey of improvement of the organisation. On that note, Chair, I'll hand it back to you.
Thanks, Matthew, for that. I mean, I hope people who are here, both board members and partners and staff, recognise that we are absolutely passionate about wanting to do the best for our patients and to do the best for our staff, as set out in the forward look that Matthew talked about. But it's this is a collective effort. This is not just one group of people. This is everybody in the organisation working with our patients and our partners to improve services and put patients first. So, thank you for listening to all of that. We've got an opportunity if people want to ask questions now. I don't know, Rebecca, whether we've had any notification of any questions.
Questions have been pre-submitted in advance, so if you wish to open to the gallery, Chair.
But I'm happy to open it up for anyone who wants to ask any questions or make any comments. If I can see you. No. Well, I recognise this environment is not always the best to do it. But thank you very much for. Well, everything's changed now. Okay, I can see everybody now, and I can see that I've got a hand up from Ian Tate from the CCG, and of course a famous general practitioner from Herefordshire. Ian.
Thank you very much, David. And it was just to say an enormous thank you. I mean, I can see a huge progress being described, let alone then being thrown into the pandemic and taking on all that's delivered to us all, clearly with some opportunities for innovation. But I suppose my question is just linked to how to maintain that energy and ambition when people obviously are a little bit tired at present. And I'm sure those, when Matthew was visiting ITU, some of those staff have, as has been described, have done a huge amount over the past year in circumstances they probably never thought they'd face. So it's just that encouragement for people to keep going, but to be allowed, I guess, to pause and take a breath, but keep the journey going, because it is a huge thank you I'd want to share as a partner to everybody.
Matthew, do you want to respond in relation to the issue of staffing?
Yeah. Thanks, Chair. Thanks, Ian. I mean, I think your words and our ability to relay your words to staff, I think it will make a big difference. I mean, I think, the recognition of other, professionals within the county for the work that people do, I think it makes a big difference. And we know, don't we, that a simple thank you goes a long way, but also that recognition and valuing the work that people do also goes a long way. I mean, we're always learning. We've put a lot of things in place, a lot of support in place for our staff. I think it's fair to say, in some of our staff, particularly our surgeons who haven't been able to operate, are very keen to get stuck in. But we also recognise, as you say, that some of the staff that will be very much at the forefront are needing to be supported to have their annual leave, to make sure that they feel supported by their local managers, and also that they feel recognised. And I think we're continuing to learn from our partner organisations locally and nationally for what we can do to help our staff feel supported. I think only yesterday our Chief Nursing Officer arranged for some baskets of fruit to be taken to a particular, I think it's down to the emergency departments on both sides, recognising that they are at the forefront of significantly increased demand. So it's sometimes the small things that make a difference. And I think if anyone has any additional ideas, we're all ears in this regard. But I think thanks from our colleagues locally, I think, go a long way, because sometimes people feel a little bit alone when they're, at 2 o'clock in the morning, they've got, a department that's full and are concerned about the safety of themselves and the patients. So thank you for that, Ian.
Yes, thanks. Any other points? Sorry, I'm waiting for Colin to raise an issue, but no, that's fine. That's excellent. Well, thank you very much, everybody, for your time. Hopefully, you've got the idea from us that we recognise the journey that we're on. We're by no means at the end of our improvement journey. We're just in the foothills of it. But hopefully, you'd recognise that we've made enormous efforts with our staff to improve services for local people. So, thank you very much for your time and attendance. Goodbye.
Thank you.